All right, we're ready to get started. This time, Graham County Board of Health meeting. Call to order. Got any changes to the agenda?
Yes, I would like to move public comment from number 4 down to the new number 6 down here. So old business will be bumped down 1, and public comment will be put as number 6.
I have a motion to approve the agenda with a change. Motion. Do we have a second?
Second.
All in favor? Donnie West.
Connie, did you make it on? Hamilton's on from the advisory board, but I don't think Connie's made it back yet.
Approval of the minutes for regular meeting August 1st. Do we have a motion for that?
Motion.
Do we have a second?
Second.
All in favor? Now, Ms. Booth.
All right. A is a nomination to the Health Advisory Board to replace Brooke Coates. The Health Advisory Board, when they convened, they they want somebody that has a mental health background because we are doing so much work with mental health. There was a couple of names brought forward, and Sonny, also known as Gabrielle Pringle Jenkins, was nominated. I spoke with her on Sunday, and she graciously accepted the nomination. So that is the Health Advisory Board's recommendation for a replacement for Brooke Coates for the board to vote on.
Have a motion for that.
Motion. Second.
All in favor?
I'm ready to make it on to council. All right. Just a minute.
All right, so next up we have Christine with our CAP program, which is the Community Alternatives Program for Disabled Adults. We've had a few discussions about her program over the last year to year and a half about the issues she's been having with the state and getting them to, that'll be a little bit bigger for everybody, with the issues she's been having with the state. And she wanted to bring them to the Board of Health's attention as the situation does not seem to be improving, and to request some advocacy for the CAP program from not only from the Board of Health, but also from the Board of Commissioners. So I'm going to hand the floor to her because she is the manager of the program and she can give you a better idea of what you're looking at. This was the document that was sent to you earlier today, but we can pass it over also electronically in case you have any questions with it. Okay. And it's in your paper copies as well, in your packet.
Hi, my name is Christine. I've been with the CAP program since June 2004. Right now, we are dealing with 2 years in of NC Medicaid being in charge of all the referral intakes, which is something that we were in charge of prior to October 2020. Since that time, Graham County has had 86 requests. Before we turned everything over, we had a 0 wait list. That means as soon as someone applied for the program, I could help them through the process, get the paperwork to their doctors, get consent signed, get it called into the state for approval, get them assessed, and get them on to services within a matter of 30 to 45 days. Since the state has taken it over, we've had 86 referrals since October 1st, 2020. We get those, and we are also, for some reason, now accepting referrals from Clay County, Swain County, and Cherokee County. Those are not included in the 86 that are for Graham County. We take referrals from anywhere in the community: doctors' offices, hospitals, aging agencies, any people in the community, anybody that might be interested. Does anybody here not know what CAP program is?
I don't know what CAP program is. Can you please explain?
It's the Community Alternatives Program for Disabled Adults. It's a Medicaid-funded program for people 18 or older who will receive North Carolina Medicaid for the age, disabled, or blind, who have a medical disability that requires some kind of intervention to help them remain at home safely. These are people who would be at risk for nursing home placement, but want those services provided in the home. And typically, those services can be provided cheaper at home with better outcomes than they would if they had to go to an institution. So our program is to keep people in the community and out of the nursing homes. So of the 86 people that have applied since October of 2020, we have only received 9 back from the state for admission. 2 are right now in the process of being reviewed by NC Medicaid. We got 1 additional one back last week that I will schedule for admission. What I'm finding is the state of North Carolina has 105 days from the time a person calls and says, I want on the program, to process it and get the information back to us on whether or not they accept it for admission or say no, they don't qualify. I have 1 right now pending 106 days, 1 pending 130 days as of last week. 3 people who were in the application process passed away before the state of North Carolina processed their referrals. 4 went to long-term care while they were waiting. 1 applicant decided it wasn't worth waiting and decided they no longer wanted to help. 14 applicants never received their paperwork before the state just completely denied their request. When we're told we are not supposed to help them through the process because it's considered a conflict of interest, because now we are no longer the only case management agency in Graham County. There's 2 more that people can choose from. But if we do not help them through this process, regardless of who they choose, they don't know what they're doing. They don't know that they're time limited. They only have 10 days from the day they get this paperwork to get it completed and send it back to the state. They think that mailing it in is going to get these referrals processed faster. It doesn't. Sometimes when it gets mailed in, the state says they never got it at all. I tell people to bring it here and I'll fax it, because then I have a confirmation that says, yes, you guys got the paperwork, this is when you got it. But we're finding people just aren't getting, like at 14 said they never got the paperwork. 40 applications were closed with paperwork never having been received. 23 applications only had partial paperwork submitted back to the state. And 9 referrals are in consent processing, which means they haven't been in long enough for the state to make a determination. And the last I spoke to them, only 3 of them had ever gotten their paperwork. 3 more I couldn't get a hold of, and then I requested the paperwork be resubmitted so these people could get their paperwork. We have the capacity to help 77 people with 3 additional slots for people with Alzheimer's or dementia. Right now, we have 59 slots filled, and we could be helping these people, but the process is taking entirely too long. People are either giving up, passing away, or going to the nursing home before we could get them help. And I just want to know if you guys can advocate for us to have any kind of help with this process at the state level.
I'll be glad to advocate for you. I just need that information, Christine, Mr. Conlon.
Okay, I'll get it to you.
Yeah, I'm guessing that was a legislative decision, a legislative change. I'm not really sure. I've emailed, Christine's emailed on multiple occasions, and we get nowhere with the state. So,
one other thing, Christine, if I can get a legislator in here to talk with you, would you be willing to meet with us?
Absolutely.
Thank you.
Does anybody have any questions with the CAP stuff? Okay. So next up is the Health Department Annual Report. We present this every November. This is the 2021-2022 Annual Report. We are accredited through 2025. Due to COVID, it was every 4-year cycle, but now they've reduced it, or they've extended it by 2 years because, well, COVID. So here we are. So this is the 2021-2022. Scroll down. This is the Health Advisory Board. We will be adding, obviously, this is as of the end of the fiscal year. So these are all of our health advisory board members. These are the highlights. So obviously this report is 21 pages long. You all have a copy of it. We won't spend a tremendous amount of time on it. We'll just go over the overview. So we have been awarded several $1,000s worth of grants. We did launch the tele-obstetrical services with Harris Women's Clinic last fiscal year. That is on hold as Harris does not have enough staffing, just like all the rest of us. So their equipment is still here, the service is still available should they ever be able to start that back up. We saw another successful year of the Erlanger School-Based Health Center. The peer support specialists continued their awesome work in the community and reaching far beyond us and into the regional partners. We continue to collaborate with the Appalachian Mountain Community Health Centers on the Rural Community Opioid Response Program, which is RCORP. We also work some in the schools with the students to provide different education to the students and faculty. We also had our inmate health screening program, which included vaccinations, STD screenings, and education. We continued our agreement with WINCAP for syringe exchange. We completed our 2021 community health assessment and continued to work on Medicaid transformation. So, in all of its shining glory. So, the peer support specialist work. Do you guys want me to go through this, or are you guys good with it? Commissioners have an opinion one way or another? You want to go through this, work through it? Okay, you do. Okay. So this is the peer support specialist work. This was Recovery to Work grant. This ended in April of 2022. So this is a complete overview of her program. She served 48 clients total by the end of her grant cycle. It tells you all about the referrals she made, where her referrals came from. Over 100 times, these 48 people were referred to resources outside of the health department. We housed 9 of those clients. We had thousands of dollars in funds to purchase items for the clients to help overcome barriers in maintaining their sobriety. We collaborated with the CLC program, which is Clint's program, to make sure that folks had toiletries and sleeping bags and food and supplies. We worked pretty closely with transit to make sure people could get to their medical appointments and also get to work for those participating in the Recovery to Work program. They also collaborated pretty heavily with NC Works in Tri-County. Is that still continuing, Bethany?
Yes, that lady has moved on to take a different position, but I'm working with the people that may have to.
So community linkage to care, that is Clint's position. So this is the one specifically that works with law enforcement and the jail. So this will tell you, this grant is continuing. So this one is ongoing through May of 2023. So this grant was actually picked up also by Bethany towards the end of last fiscal year, but this was mainly Clint's last fiscal year. So this will give you an idea of, so he served 31 new clients, because again, this one's continuing, and by the end of the fiscal year, 11 were still active and 6 were employed. So this tells you how many he helped get in. MAT treatment is medication-assisted therapy. So that's like Suboxone. Counseling, Celebrate Recovery, other groups. This is his referral source, mainly, of course, was jail, because that's who he was working with. Resource contacts, they both did an excellent job of building resources outside of Grand County because we are so lacking in those services. First at Blue Ridge has been a really big help for Clint, as has, I think they started working pretty closely with TROSA as well, if I'm understanding correctly. And TROSA is out of Raleigh, correct? Yeah. Okay. So they have gotten everything from refrigeration work to painting to carpentry to landscaping as far as employment. This is the funds that were shared between Recovery to Work and CLC to make sure that everybody got all the care and toiletries and stuff that they needed. And they also were still working at this point with Tri-County Community College to get the GED program running smoothly in the jail. It is running. the biggest issue they're running into is that obviously the turnover is very high in the jail. So trying to make arrangements for after they leave the jail to continue that GED program. So that's the issues that we're working on right now. Nothing that anybody of any fault. It's just that they don't typically stay in the Graham County justice system long enough to complete the GED program. So that is something that Clint is working with them on the regular, trying to get that worked out. So, and during this time, they had 4 that did participate and get their GED. So many more than that participated, but actually completing the courses, they did have 4. So this will tell you all about our wellness and health education. Really a lot of things around vaping this past fiscal year, and then opioid messaging campaign. Obviously, COVID was still a big thing last fiscal year. It sort of wound down for this fiscal year, but last fiscal year it was still a major, major thing. So we were still collaborating very heavily with the WNC Health Network to get that message out there. But we have switched at this point to more the opioid messaging, vaping, and drug awareness. So, and the WNCAP needle exchange program continues, and then the jail screening, which does include a health education component. WIC continues to be auto issuance. So in other words, when somebody gets their card and they are issued to that initial certification, the state auto issues to that person after that. That has not stopped, and that is set to continue through April of next year. So I don't foresee this changing anytime this fiscal year. So that's the reason you'll see kind of big fluctuations in these numbers, is because they do not have to come into clinic. We are encouraging, we're trying to work in the steps of getting them to come back and getting them used to come back into clinic, but it still is not required by the state of North Carolina. Our redemption actually went up by almost $20,000, and this is an in-county redemption. These are our clinical programs. So the first up is adult health, which went up drastically. You'll see it was 715 patients seen. So patients seen is the unduplicated. So this is not repeating. Number of visits is that person can repeat multiple times. So number of patients was 715 non-repeating, but they were seen 1,156 times. Does that make sense? Okay. This was 2020, 2021. This is 21-22 fiscal year. BSEP, we have a cap. Every year we seem to be getting an increase. When I started here 5 years ago, I think it was 18 or right around 20. It went up to 2023 2 fiscal years ago, and last fiscal year it was 28. And we are on track, it looks like, to probably use up those 28 slots again. And 28 is all we get. So we exhausted all of our slots. This is child health. It remained pretty steady. This isn't a huge change. So we still do not do child health well visits. That is contracted out to AMCHC. So this is all what we call sick child. So lice checks, ear checks. My kid has a fever. He has a snotty nose. Thing that needs things that was immediately behind him. Okay. So those are all sick child. Those are no well child. Family planning doubled last fiscal year, or 2 fiscal years to last fiscal year. So unduplicated patients in 2020-21 was 88, and last year it was 162 for 174 total visits. Maternal health stayed pretty steady. It dropped by about 10. All maternal health is for us is pregnancy tests. So just kind of not really indicative of anything in particular other than just pregnancy tests is all we really do. We don't provide that as a contracted service. STDs remain pretty steady. It was 34 patients seen. This past year it was 30. This is labs. Labs was very busy last fiscal year. It more than doubled last fiscal year across almost the board. So the NC State labs, so what we do is a lot of those private labs, which is Quest, and a lot of our in-house labs. We were very busy. Our lab was very busy last year. This is dental. Remained pretty steady. Again, unduplicated patients almost on the market, went up by 20 patients. So this will give you an idea of where most of that work went. Root canals remains pretty steady. Cleanings about 100 more. Fillings about 200 more. X-rays about 200 more. So remain pretty steady from the previous fiscal year. This fiscal year, though, by projections going on what we're going on right now, is going to be drastically higher. This is capped. So this will kind of give you an idea of what Christine was talking about. All the numbers dropped. And not to the fault of Christine and Sydney. There really is nothing they can do about it. So you'll notice a drop in admissions, a drop in discharges. And like I said, we covered that earlier, so if you have any questions about that, we can refer back to Christine. So environmental health, I can include these numbers, but they're not going to be accurate because since that position was vacant from October of 21 through the end of the fiscal year of last year, the numbers were not reported. So Shelby, God bless her heart, did the best she could to get those numbers together, but they are not accurate. So but I'm a big reporter, so I reported them, but understand the numbers are not accurate. So it's the best we could do, knowing that these were not done in our facility. These were all contracted out to Swain County. So we're keeping track of it for this fiscal year. But like I said, you can look over those, but it's not going to be real accurate. I put dashes because I'm not going to say it was none, because I don't know that. So we put dashes because that was not reported by our contractors, at least not for us. So number of applications we went through and hand counted. So again, how accurate it is, we don't really know, but we are keeping it for this fiscal year. So we did have a lead case this fiscal year, though. All right, and that's the end of that report. Do you have any questions with the annual report?
Contractors, I wouldn't know how many they do, and how do you know where they're going?
Well, so we used to keep, when we had someone on staff, they kept an actual running spreadsheet. So when I say we went back and hand counted, that was exactly what we did. We went back and hand counted out of emails and out of paper copies. But because we contracted for such a long period of time, people also developed the habit of calling Swain County directly, and then we would find out on the back end. So, yeah. I mean, we literally would find out on the back end. Or we would find out because they would contact Jacob directly, and then we would find out secondhand because we just didn't have anybody here. So they would either reach out directly to Swain or they'd reach out directly to Jacob, so we didn't get that first filter. So, like I said, I'm not going to sit here and say that these numbers were accurate because hand counting is usually never accurate. You know, you need to keep a running total as you go through, and we had no one on staff to keep that running total. So those numbers were reported to the state by Swain directly, and so in order for us to get those, we would have to go back through and get up with Swain and have all those reports pulled back to us. So, and with Shelby coming on board in July, we just didn't have time. So it's probably going to be something that we go back and we mess with over time to get the numbers more accurately reported. But by the time I turn this report out, these are kind of preliminary numbers. We can go back and see if they've reported the numbers to the state because that's their contractual obligation. But we'll see.
How do we stand at this point with backlog?
Shelby?
It's usually 4 to 6 weeks out just because I'm the only one and Jacob who are able to do site visits at this point. But like right now, probably like 3 weeks out. So things have sped up, which is good. A lot of other counties are usually 2 to 3 months behind at this point. So I'd say 4 to 6 weeks is positive.
All right, client satisfaction surveys. Cap did theirs separately because theirs is actually mailed out and comes back in. Hand delivered, sorry, hand delivered. And then they're mailed back in?
And they mail them back.
Okay, got it right. So 40 of 60 surveys were returned, and these are the questions that were asked. And this will tell you, they are kind of just yes or no answers. So because, a rating scale sometimes for some people isn't what they need. So these are just yes or no answers. Again, you can read through this. I'm not going to read through them, but there was as far as the comments, those were some of the comments. I like the comments more than I like the yes and no answers. So yeah, everybody had great things to say, which Christine and Sydney are great. So those were the client surveys for CAP. And then our client surveys for adult health and walk-ins, because ours on the health department side just kind of goes in general terms. Like they just circle what they came in for. So this will kind of give you an idea. The only one that actually, well, unless they do a very good job, and they do because they're all sick. But the only one that left a comment was about his blood donation. And unfortunately, we don't schedule blood donations. So this person was very upset that they had to wait for an hour and a half and then couldn't donate blood. So, but we can't do anything about that. That's Red Cross. So,
But we listen.
But we listen. That's right. So, yeah. But otherwise, everybody said that they thought they did a great job. And then down here, BSEP and WIC, they didn't leave us any comments, but they were all satisfied with their service. So. All right. Did you have any communicable disease updates, Loretta?
No, just that our nursing staff continue to do the educational webinars related to what's prevalent right now with respiratory illness, increased hospitalizations, especially with children. And of course, we're keeping up to date on monkeypox. We've done several web trainings on that. And we have some policies in place, so we're staying up to date on that, but nothing else to report.
Right,
COVID is hard to judge in the community right now because the biggest majority of individuals are home testing and do not always call and report that to the health department. But as we get calls and we get reports from physicians' offices, urgent care, and ERs, we still do have the state contracted agency that's doing some limited contact tracing.
All right. Environmental health, I will defer to Shelby.
We hired a new employee, so we now have 2 environmental health employees. Her name is Carly Curtis. She attended the on-site CIT in Raleigh about a week and a half ago. So she'll start doing her on-site wastewater training between Cherokee County and Macon County. And so we'll kind of be dividing the time up between the 2 of us as I do my food and lodging training too. So we'll be kind of simultaneously training. She's great. We love her, and we hope she stays a long time.
And so we should have, she can't do her food and lodging until this spring, but we are hoping to have both of them authorized. I think you're finalizing your on-site stuff right now. And Carly's getting into her on-site right now. And then hopefully food and lodging will be done.
She can go to food and lodging in April.
You'll be done.
Yeah. Oh, I'll be done. Way before that.
So, yeah, we are getting it. We're getting it all worked out. So, and then she has general module, which is pools and tattoos and whales next week.
Virtual.
Yep, virtually. So she does not have to go back to Raleigh. All right. So dental. So the dental contractors has worked out very well. I think Kelsey has had a good time. She hasn't told me otherwise. I don't know that she was.
Still having a good time.
Oh, I'll let you
Still
know.
having a good time. So with this, and this is a conversation that I've mildly had also with Connie. So is the frequency of having those contractors in our facility. So, because what you are looking at is the possibility that Medicaid expansion is going to come back onto the table in December for legislative session. If that happens, we are still the only Medicaid provider in Western North Carolina taking new patients. Let that sink in for just a minute. We are the only Medicaid dental provider in Western North Carolina taking new patients. So I want to get the Health Advisory Board and Board of Health's opinion on what you think we should do as far as contracting with a dentist and or a hygienist, and how often you think that contract work should happen.
Did we not talk about this the other day?
Not solid, like not how much y'all, because I have to adjust the contractor lines at that point. Like, this is a decision we need to make because we're going to have to do a budget amendment because we've used pretty much that entire contractor line. So depending on what y'all tell me, depends on that adjust. Like, I'm going to have to go back and add in salary, well, not salaries, but contractor dollar amounts to cover through the end of the fiscal year. So we need I need a way to project. So, I mean, we can do monthly. Like right now we have a hygienist that comes in monthly on a trial basis, but it's something I'm doing each month. I'm not again, projecting it out. Do we want to do it on a Friday? Do we want to try to do it during the week? You know, those are the kind of decisions with the Board of Health and Health Advisory Board that I want. I mean, what do y'all think? This is me asking for y'all's thoughts. So,
By providing the services, it generates more revenue than it
correct.
takes.
That's the objective.
So additional revenue is a good thing. Can you find people? Can you find a hygienist? Can you find a dentist that's willing?
There's a dentist sitting right there.
You have one in mind, I guess.
And Cassie, we have a standing contract with Cassie, the hygienist. Right now she's living in Leicester, but Kelsey also sacrificed one of her hygienists to me that was also interested in contracting. So do I have contractors? Yes, I have contractors. So really does come down to the board.
How often can you do it?
We were thinking monthly. I don't know if Kelsey wants to commit more of her time than that.
I can do at least a day a month, and so I figure that, conservatively, I could probably see somewhere between 16 and a really, really good day would be between 6 patients a day on my side. And then if we did double hygiene, which is what Janie usually does anyway, that'd be similar on hers. And so we'd make a pretty decent chunk in the backlog because they're just seeing a tidal wave of patients right now and just need help.
Do you anticipate additional patients? And how many?
We're backed up right now on new exams to April. That's new patients. So a new patient can't get an appointment with us until next April.
We fielded 11 calls for new Medicaid patients in my office today and referred them to your dental clinic today.
So it seems like you need more than Kelsey.
Yep.
Probably by the end of the day, yeah. That's
I'd do as much as
I'm trying to
possible.
ease y'all into this.
Can you find more than Kelsey?
If we come to that place in time, then that's going to be a conversation we have to have. I'm trying not to sticker shock y'all to death.
And what is Mr. Fredericks? Where does he stand on this?
Well, I mean, the problem is that he can't work any faster than he's working. So,
As far as bringing in outside help.
yeah.
Is he
Yeah, I mean,
blocking?
he's
Is he resistant?
He's ambivalent. He knows that the patients have to be seen, and he's really trying to work as hard as he can to get them all seen, but he also recognizes the fact that he can't get them all seen. So it's one of those places that the dental clinic has come to realize you just can't do it all. With the staff, the way that it's staffed right now, no matter how hard you try, no matter how hard you push, you just can't get it all done. And so that's the place that we have arrived at is There's no way we're gonna be able, like, right now, we went to a conference with Dogwood Health Trust Dental Consortium, and I took Janet, and there is a dental clinic in Asheville that has a 2,000 person waiting list. It is completely ridiculous how anywhere, the clinics were reporting anywhere, the dental clinic that ECU does in Silva, 1,500 people is their waiting list in Silva. And they wind up on our doorstep because we will take them. And yeah, we're booked out a ways, but we try not to wait list. Like, you're just going to get an appointment, it's just going to be a while. And then they get called if we have a cancellation. They'll call and say, if you can make it. The thing is, right now, there is no dental clinic in Cherokee County that provides dental Medicaid. None. Not even has a caseload of dental Medicaid patients. Nobody in it. So AMCHC is looking to open a dental clinic in Cherokee County in 2023. I don't know when, and I don't know what kind of their staffing they're going to have and that kind of thing. But they did say at the consortium meeting that they were going to open a dental clinic that would take Medicaid in 2023. So what that looks like long term, I'm not really sure.
This may sound crazy before you can say it probably is, but I mean, extended hours, I'll say it like that. Extended hours, recruit dentists on a month-to-month basis. Eventually new clinics will be getting opened in other areas. But there's a lot of revenue there, it sounds like, that can be generated, at least in the short term.
So if we extend the clinic hours, the biggest thing there is right now we have our dentist and one of the dental assistants and the hygienist are all 32 hours a week.
So you have to recruit all those people to go with it.
Yep, and we'd have to up all those salary lines. So right now I'm just upping a contractor line. So if y'all want to extend the hours, I'm going to have to do some major budget realignment.
Could all those additional people not be contract employees like the dentist?
So are you talking extend the hours like on Fridays, or extend the hours like past 5 p.m.? What are we talking?
Extend hours past 5 p.m.
Either one? Or do it on Fridays?
Open on Fridays, open on Saturdays. If you feel, if you can find people, it sounds like you've got the clients.
Yeah, I think we can locum tenens the dentist. Honestly, I could honestly probably get a dentist before I could a hygienist, as far as you pay them enough and they will come kind of thing. I don't know that I would be able to find a hygienist that would be willing to do it, but I can look. I mean, all I can do is ask, right?
Well, that's about the only solution.
Yeah, I mean, I know, like I said, I know I've committed Kelsey to the crucifix and said, she absolutely will do it, So to get more than 1 day a month, that's going to be a conversation that I'll probably have to have with either a locum tenens, because I like Kelsey, so I'm not going to tell her she'll do it more than that. So to get like every single Friday, I may have to actually go through maybe ECU Dental School, Kelsey.
Yeah, that'd be really cool. The health department used to do, I did it when I was a dental student, a rotation there. And so it would be awesome if that was another option. I know there were some issues there for a while, but I would go that route and just see if it's possible.
Okay. So like I said, honestly, ironically, I could probably find a dentist before I could find a hygienist, would be my guess. So, but I can try. I mean, all I can do is ask. So, so what I will reach out to the ECU Dental School, or I will ask Kelsey to get me a contact to reach out to the dental school, because I don't know who actually does that. So what do y'all want to do? Do you want to do the 1 day a month like solid and me start putting out feelers, or what do you want me to do?
I think we can only do 1 day a month right now.
Okay,
Yeah.
so I'm just
Stick with
thinking
what
for
we can
budget
do,
amendments,
and then,
you know,
yeah.
and all that kind of stuff, because I'll get with Becky and we'll adjust the budget,
If
but I
we
want
can
to make
bring
sure.
your paper
y'all-
along, we can do budget amendments there.
All right, so I will start with that one and forecast one day per month for a dentist and a hygienist, and then I'll put feelers out to see if we can find somebody that wants to do it.
Has your advisory board spoken about this to you and with you and all of you?
Yes, yeah,
What
we
is that
talked.
recommendation and just their feedback on it?
Yeah, that was, so we had a dental QA/QI meeting, which is quality improvement, quality assurance meeting. Oh goodness, the beginning of October. And that's when we sat down and came up with this plan. And then we talked about it at the Health Advisory Board meeting a little bit. And they all thought it was a good idea. That's where Kelsey came and said that she had a hygienist that would be interested in working with her, with us, one day a month. So we're solid with at least that one day a month, and in agreement. So, and then like I said, we can always, especially if Medicaid transformation or Medicaid expansion happens, that's definitely something we're going to have to revisit. But we don't have to do it right this second. So,
Can I regress just a
sure.
second back to the CAP program?
Yes.
What is your advisory board's input regarding that? And this looks like we're like 2 years into this awful delay in services here.
Health Advisory Board, your thoughts?
Horrible. Yeah.
I got a horrible.
No wonder I can't get patients in. Somebody's bad.
Yeah. Anybody have any other thoughts on the dental and the contracting? All right, so we'll move on to the essential services report, and this is itty bitty, and let me blow this up. Lord knows nobody can see that. I can't even see that. All right. There we go. All right. So, this will give you an idea of the budget that we've used and the revenue that we have made. So obviously, COVID and communicable disease, this is that huge pot of state funding that we have just got to work to draw down. This will be the last year of the COVID funding, and even this big pot right here has a huge amount of strings on it. They didn't add a lot of strings for the last 2 fiscal years for COVID, but this COVID money, even with this huge pot, let's see, yeah. We can't charge a bunch of that to COVID because they will only allow this time around. We've got over $200,000 worth of COVID funding, but they're only allowing it for direct clinical services. So last year they allowed the non-clinical services, which is where like when check-in checks in COVID shots and they field COVID calls and they give out COVID tests and stuff like that, they were charging all that as non-clinical time to COVID. Well, the state's not paying that anymore. So we have this huge pot of money for COVID revenues, but it will only pay for nursing time. It won't pay for non-clinical time, which is irritating because COVID is still here, but such is life, I suppose. Child health. We have had a lot of child health already. This is 56% of the projected budget has been used for child health already. Your revenues are going to drag behind because of Medicaid transformation. We can discuss that when we get to the bottom of this sheet. Maternal health, again, this is just, it's running right on target at 35%. We're about a third of the way through the fiscal year. That's about right. TB is running hot, and we've already generated 102% because we are managing TB cases now. So, whereas that used to not be a thing, it is a thing now. So, we do have, our nurses are doing active TB management.
And can Can we go back to child health?
Yes, we can.
One reason that the budget looks like it does for child health is the pediatrician that was at Tallulah is not available now. So the nurses are doing lots of ear checks, haven't we, Megan? We've seen an increase in throat checks, ear checks, and that's child health money. We're able as a nurse to be on Medicaid for that nursing visit. So that has really increased with the pediatrician being out of the office.
And unfortunately, we really hope when we can get to this after we finish, but as far as, I don't know, Jill, if you have any updates.
He is now currently 1 day a week, but is planning on being only in the civil office. His wife is very ill. And we do have 2 new clinicians coming starting the first of the year, and one is wanting to do primary pediatrics, a nurse practitioner, or I'm not sure if she's a PA or a nurse practitioner, but that's the plan. So as soon as we get him in and get him trained, he might not have as many ear things to look at.
It'd be awesome to have somebody to
Right now,
my
my clinical patients, even for rechecks, I'm out over a month before I can book somebody in.
And this is something I want you to notice right here, our family planning, right at 34%, which is perfect. We've used a third of the budget, which is awesome. We have generated 48%, so almost half of our projected revenues already for this fiscal year. But you notice child health is up here at 9. The reason that this one is so much higher is because it was waived from Medicaid transformation. So this still remains a fee for service, which means that we can just bill Medicaid directly for this service and get direct payment. Whereas Medicaid transformation up here at this 9%, we have to bill a private company. The private company tells us they deny it. We have to reach back. They reach back. We reach back. And it goes back and forth and back and forth and back and forth till finally we get the claim paid. So we're easily eating up 2 to 3 times more billing time because of Medicaid transformation.
Stephanie loves transformation.
Yes. Every day. This is our life, every day. So that will give you like a prime example of 9% and 48% when you can bill Medicaid directly and get just paid versus when you have to go through Medicaid transformation. It's a pain. Healthy communities, this is all of the state funds and donations. We've used right at a third of the budget. This is likely to go up because we will be starting the drug awareness classes in the school. They're LEAD classes, which is a whole evidence-based curriculum. And so the school was doing it, and like many things, it just, they don't have enough staff to do it. And so my staff stepped up. 7 of my staff have either been voluntold or volunteered to go to the school and do classes. So you'll probably notice this budget go up a little bit starting in January because that's when we're going to start spending some time in the schools. Environmental health, right at a third. So it's right on target. We've already generated 44% of our expected revenue. Went down too far. HIV and STDs only at 12%. We've drawn down most of that state fund. We don't generate a tremendous amount of revenue. This is a lot of state funding. BSIP is pretty much on a cap, as far as we can only spend so much and we can only make so much because it's state funded. We've used a quarter and we've made a quarter. CAP, we've used about a quarter and we've made about 37%, which is about right on target. Dental, because we ended up getting our cost settlement, is already at 76%. This tells you how much this dental clinic has already put in as far as revenues this fiscal year. We are already at 3/4 of what we anticipated receiving this fiscal year. So they are doing awesome. And they're about to kill themselves. So,
and as the new chairs put in?
Yes, our new chair is here.
Okay.
And it's beautiful and it works very well.
Okay.
And then our other ones are ordered and there's a 30-week lead time. So, but our other one's in, you'll have to go down there and take pictures of it. General health, we have already eaten through 55% of that budget. Because, my gosh, this has been a lot of audit and a lot of admin has been poured into general health. 54% because it comes from state funds. So once we run out of state funds, that's just the end of that. Immunization action plan, perfect, on target. It's generated 10% more than expected at this point. WIC, that's all state funds. So we have eaten through about 24%, 14, and then 38, so right on target. And this is just drawing down the state funds. So this doesn't make any difference. Breastfeeding for WIC, again, same thing. Food and lodging, we've only used 2% because we don't have anybody authorized. As soon as Shelby finishes her authorization, we'll start eating through that food and lodging line. But right now, we can't charge to it because we don't inspect restaurants because we don't have anybody to do it. So whereas our contractor line is all in environmental health, like the big environmental health budget. So as soon as we have people that can inspect restaurants, that'll be drawn. Adult health, right at a third. Again, it has to go through Medicaid transformation, so you're sitting right there at 2%. Preparedness is all state funds. Community linkage to care and our huge Dogwood Health Trust grant are both they're grant funded. So that's just us drawing down all of our grant funds. We did do a budget amendment that I think either Becky presented to you last month or will be presenting to you this month because this grant went from $242,000 to $263,000 because I had to do a budget amendment. So, any questions with the fiscal report? All right. Next up is, let's see, annual policy review. Now, God bless y'all. If you want me to open all of those policies, I will be happy to do so. I am assuming that you read them. I will go over the changes that we made. So the tobacco policy, cut it off. The tobacco policy had to have a major overhaul. So this is actually something that's got to change for us, EMS and DSS, and anyone else who accepts Medicaid funding. CMS, in order to comply with their regulations, which begin April 1st of 2023, anyone who accepts Medicaid funds, the campus must be smoke-free. Not just 50 feet, it was always 50 feet from the building. And now CMS is telling you that is not good enough. It must be the entire campus is tobacco-free. So that includes chewing tobacco, vapes, cigarettes, cigar, anything that has a tobacco product in it. The entire campus must be smoke-free. And so that whole policy has been completely overhauled. It was looked at by the tobacco branch with the state. They gave it the green light, so then I put it into y'all's hands. The operating procedure, it was the health department had been the meeting place on the operating procedures. We had been meeting down at county administration, so I changed it accordingly. Ironically enough, we ended up in this room tonight. So we ended up back at the health department after I changed it to the county administration. So if y'all are okay with that change, staying at county administration, that's the change that I made. Recruitment, I just updated some resources as far as where we post jobs, like NC, because it said, I think it was the old version of NC Works. So, because it used to be called something else. And so I changed the policy and it says NC Works now. And then observing public health rules, I updated the hyperlinks because they were sending you to non-existent web pages. So I had to go back and erase all of those hyperlinks and redid all the hyperlinks. But otherwise, the text inside of those policies did not change. And so I need a yay or a nay on all of your policies.
Did we have a motion?
So moved.
Have a second? Second. All in favor? You hear it, Tommy?
Nope.
It's not.
Hamilton, you on the phone?
Yeah, I'm still here.
Thank you. All right.
Yes.
Okay, there we go. You good with the policies as they're written, Connie?
Pardon?
Are you good with the policies as they were written?
Yes.
All right, grants. We have lots of grants running right now. Great Smoky Mountains Health Foundation grant, the dental grant, that bought all of the new dental equipment. We will be applying for that grant that the Kid Smiles Delta Dental, because we discovered after Kelsey brought it to our attention that those new drills we got, I think it's drills, correct me if I'm wrong, there has to be something done to them every time you use them. What is it?
They have to be autoclaved.
They have to be autoclaved every single time that you use them. And we don't have enough for that. So we're going to also apply for that Delta Dental grant to basically buy the exact same thing we bought for the Great Smokies Health Foundation grant, because we have to have more of those drills because we didn't realize that they were going to have to be autoclaved every single time. So we'll probably be adding another grant to this. And if we don't get that grant, then we'll probably have to purchase those. It's about $5,111, I think was what it came up to. Dogwood Health Trust Dental Grant bought the new dental chairs. That has been executed, and those chairs have been ordered. That was $38,000. The CLC grant, both of those progress reports are in your packets. If you have any questions with those progress reports, by all means just ask. Otherwise, that grant execution goes through the end of May. AA 620 is a Heights collaboration that we have just started doing. So Heights is a mental health and behavioral health. They focus on youth out of Jackson County. We are teaming up with them to provide the START program in the schools. It's going to be START-like because we don't have enough to provide a full START program. START is, you ready? Sobriety, treatment, and recovery team. That's a START team. So the goal in a START team is to catch those kids that are struggling, and those families that are struggling, but it's not become a foster care DSS issue yet. So it may be something that with a small amount of intervention, like if the kid is sleeping through class a lot, or if their clothes are dirty, or they're coming in the same clothes every single day. Something like that. And this team can step in and say, what do you need? So it may be that they have their power cut off, and that's why they can't wash their clothes. And this team, which includes a behavioral health person from Heights, Clint, Bethany, Hamilton, are all on this team. Did I miss anybody? Bethany? Okay. To make sure that those families get the help they need to hopefully bypass DSS. So the ultimate goal here is to reduce our foster care rates, because Lord knows we all want that. So the goal is, if we find out the family is living in a tent, or they've had their power cut off, or they've had their water cut off, or they don't have a washing machine, or they have no heat, or whatever, that we can help that family work through those issues and get it fixed for them before DSS has to step in. So, and this also will be a collaboration to do what's called a PORT team, which is a post-overdose response team. So, same scenario, but going through Hamilton, when somebody has an overdose, that this team can step in between behavioral health, peer support, and Hamilton at EMS can step in and hopefully either get that person into rehab or treatment or whatever services that they may need. To again, hopefully curb or avoid any trauma, any extra trauma for that family. So the whole goal here is to try to stop the cycle that this county has lived in for generations, and to improve. So, because we have to stop it for these kids. So the goal here with both of these teams is to reduce the trauma. So anybody have any questions with any of the grants that we have running right now?
I don't have any right now.
All right. So we have come on down to family planning on our agenda. At this point, I am going to defer to my clinical team with Loretta serving as the spokesperson, with her deferring to her team as needed. to cover all of their information, and then I will close it out with any thoughts that I have after they are finished.
And I will come and sit here so that it'll be easier for Connie to hear me because my voice is kind of squeaky and weak at times. So, sorry.
Just squeeze on
We're
in,
at
Loretta.
close staff. So basically, if you don't know who I am, I'm Loretta Eller. I've been at the health department. I'm going into my 28th year. Somebody sent me home. It's about time. But we have been doing family planning services since I began working at the health department. Family planning services provided by public health, provided by Grant County, are not an option. It is a state mandated service. So if the health department does not provide this service, we have to assure the service, which means if we are not providing family planning services, the clients will be sent to another provider and we pay for it. Thankfully, we received Title X grant funding, which provides this service, and for lower income individuals, we also can see insured clients through our clinic. It helps us receive medications for STD treatment through the 340B program. It helps us receive contraceptive methods. Let me say emphatically, we do not do abortion pills of any form, shape. Whatever anyone's belief is, and we're not going to answer the question of when life begins tonight. That's a personal view everyone has. But I can tell you what I know factually. And if I misspeak, Caitlin, Jill, any of the medical providers in here, feel free to correct me. But contraception is prevention. So when you believe when life begins, whether it be when the egg is fertilized or when implantation occurs, contraception prevents ovulation. That is, it prevents the egg being released to where the sperm can reach it. If you're uncomfortable with this discussion, this is public health. We discuss uncomfortable things. So this is package inserts for every hormonal method of contraception available. I can tell you every one of them starts out with it prevents ovulation. The second part is it thickens the cervical mucus, which is like cement and will not let the sperm reach the egg. Also, another mechanism, which is on the bottom end of the tier, but it can, because it's hormonal birth control, thin the lining of the uterus and in effect make implantation of a fertilized egg difficult. That is all hormonal birth control, not just emergency contraception. So if there's a problem with emergency contraception, there should be a problem with all hormonal birth control. Legally, medically, and by FDA approval, emergency contraception is not an abortion pill. It will not do anything to impair a pregnancy. So that's just the elephant in the room. Caitlin, have I misspoken in any way? So let's go back to what is offered, what we are mandated to offer. In order to receive Title X, and each of the board members and advisory board, I believe Jason received it, I sent out a memo that explains all this in great detail. That memo, the information for medical content, because I'm an RN and I don't want to misspeak in any way, was reviewed by Dr. Leonard Bradson, who works with Tenova, previously worked with St. Mary's Hospital, which is was a Catholic hospital. He has 50 plus years of experience. He is well versed, and he sat on the board of ACOG, which is basically the governing, the end-all be-all for obstetrics and gynecology. And he reviewed the information, he verified that everything was correct. The abortion pill is actually two different pills. The first pill given blocks the woman's natural ability to produce progesterone, which helps the fertilized egg progress and grow. The second chemical in the second pill causes the uterine to contract, causes it to shed the uterine lining, which basically is a medically induced miscarriage, abortion. That's the abortion pills. It's not one pill. We are prohibited as a public health department by law to dispense, administer, or perform abortions medically or surgically. Our staff could be subject to criminal prosecution. We also sent that to each one of you in an attachment. It's the agreement addendum, and it's highlighted, and it says that specifically. It also says, and Beth highlighted this in the agreement addenda, that we have to provide emergency contraception. If we don't provide it within our agency, we have to refer out to another agency. So let me give you some examples, because I want y'all to see what we see and feel every day. We have a family planning clinic 2 days a month that we have an advanced practice provider there to write prescriptions. 5 days a week, our nurses perform off of the signed standing orders that the medical director reviews and approves. We do family planning every day of the week, some days all day long. Our family planning clinic is just not about birth control at all. We identify patients that have been raped. We identify patients that are going through physical abuse. We identify patients in mental health crisis. Without giving you information that will reveal a patient's identity, I can give you some information because 28 years I've got some stories to tell. When I lay awake at night over all this misinformation that's going in our community, it's not about anyone in this room. It's about the faces that I have seen over these years. So let's talk about the real cases. Let's talk about the young teenage girl that's pulling a dresser in front of her bedroom door so that daddy doesn't come in and rape her at night. That was revealed years ago in one of our clinics. If we did not have this service available, what would happen to her? Or the patient that rolls up the sleeve for the blood pressure and their arm is scarred where they're cutting themselves because of the pain in their life. Do you think the nurses here ignore that? No, we don't. We don't ignore that. We counsel them, we give them help. The woman that shows up on Friday afternoon because she was raped on Tuesday, and she shows up at Friday afternoon needing emergency contraception, and she's so ashamed. And she does not want to go anywhere else. She wants us to help her. She's not going to show up at the ER. So this is where it's going to get a little bit uncomfortable, and I'm not going to apologize. Pregnancy doesn't happen at the moment of intercourse. That's why emergency contraception can be given up to 5 days after the unprotected sexual act, because ovulation may not have occurred. More than likely has not occurred. We adhere to those rules. We do a pregnancy test with everyone that comes in for emergency contraception to ensure they are not pregnant at that time. Why do we do that? Not because it's going to hurt that pregnancy. It's not. We do that because if they're pregnant, first and foremost, we've got them sitting in front of us. We need to counsel them. We need to see what kind of help and resources they need. So that woman that was raped on Tuesday, that shows up Friday afternoon, you take away this service. We don't have Plan B on the shelves or Ella to give that woman. She has to go to the ER, which we're going to encourage that anyway because she was raped. She's still carrying that rapist's sperm inside her. God help us if we feel like we have the right to deny her the ability to prevent that pregnancy from her rapist. When you put barriers to contraceptive methods, you increase abortion. And I feel safe to say, I'm sure everybody in here, the majority are not comfortable with abortion. That's the facts. I'm not political. My husband can tell you I'm the least political person you'll ever meet. If I was political, I wouldn't have been here for 28 years. I'm not political. But when Obamacare mandated that contraceptive services and options were provided to everyone, all free, through Obamacare, abortion rates declined. Is that not what we want to do? Is that not what we want to do? You can't terminate what you've prevented. Do you hear what I'm saying? You can't terminate what you've prevented. None of these contraceptive methods abort a baby. If you believe life begins at conception, if you truly believe that and you don't want to do anything to harm implantation, your options are abstinence, natural family planning, and condoms. Period. So with all that being said, you take away our options to provide this service. The woman that was raped on Tuesday night, carrying her rapist sperm inside her body, shows up at our office on Friday afternoon. And we know how Friday afternoons are. People that need services come on Friday afternoon. So let's say that you've made the decision that we cannot give emergency contraception. We have to refer them out because the state mandates that we provide this service. So we've done the pregnancy test. She's not pregnant. We can't go to the cabinet and give her the medication after we've educated and counseled and tried to take care, call law enforcement, do what we do. We can't go to the cabinet and pull that medication out. She has to go to the ER. Guess what? Title X pays for the service we did with that woman. Title X's also, our monies are going to have to pay for that ER visit. We're going to run out of Title X funds. So what happens? Graham County taxpayers pay for that visit. That's it. Bottom line, it's going to be done. And I can tell you, with knowing the nurses there, if you want people in Graham County to get loving, comforting care and someone to go above and beyond, you want that care provided at the health department. I'm telling you that. Because we have nurses. I went to homes with a teenage girl, hysterical and scared to tell her parents that she's pregnant. And I've stood in living rooms, dining rooms, bedrooms, holding her hand, telling her what she can't tell her parents. I've lived it. You know me. Look at me. You know me. I would never lie to you. I would not sit in front of you and try to cover up something we're doing. Contraception is contraception. Can I tell you 100% that it will never affect implantation? No, I can't. It's hormonal contraception. The main mechanism of action is it prevents ovulation. In a perfect world, there wouldn't be rape. In a perfect world, pregnancies would only be planned. But we don't live in a perfect world. What we can do in Graham County is take care of our clients the best that we can. And we do. It's not a visit of coming in, I think I'm pregnant, can I have that pill? We talk to them. We do a physical assessment. We do a history. By the time that individual leaves, we know what's going on with them. We know what they need. We screen for depression. We screen for abuse. I know everyone is uncomfortable with the fact that teenagers come into the health department without consent of their parents. I want to tell you something earth-shattering. Teenagers have sex. Whether we're here or not, teenagers have sex. would you not want them to talk to one of us? If it were your child having sex, would you not want them to talk to one of us if they can't talk to you? And what we do, first and foremost, and Megan's family planning coordinator, she can tell you this, the first thing we talk to them about is, do you have a parent you can talk to? It's so important that you talk to your parent. Do you have a trusted adult you can talk to? It's so important that you talk to them. The second thing that we talk to them about is abstinence. Abstinence. Take care of your body. Respect yourself. We talk about sexual coercion, and when I say we talk about it, these nurses are trained. We're trained. We don't just pull it out of a hat. We've had trainings. We know how to screen for abuse. We know how to tell if somebody is in crisis situation. Has our clinic saved lives? Megan, has our clinic, Glenda, Sean, our clinic has saved lives. There's little girls out there that's not getting raped right now. I can tell you that. There's little girls that's going to high school that now know that when a boyfriend tells them, if you don't have sex with me, I'm going to tell all our friends you did anyway and tell them you're a slut. We tell them that's wrong. That's sexual coercion. That is wrong. So if I leave you with anything, know that if this is affected, if you say that we can't keep Plan B or Ella in stock and administer that, you are doing harm to Graham County residents. If you limit our ability to provide this service, that is harm to Graham County residents. We are educating, we are encouraging, and we are referring. We are not aborting in any way, shape, or fashion. So if implantation of a fertilized egg is the big concern, there's the potential with every one of them. That's hormonal birth control, but that's not the main mechanism of action. Emergency contraception, we want to catch them before they ovulate. We want to catch them within that 5-day period. Why should a rape victim ever have to deal with a pregnancy from her rapist if it can be prevented before it happens? Why should a 14-year-old girl ever become pregnant if it can be prevented before it happens? We're preventing. We're not terminating. I would not be here if that were what we were doing. And the counties, surrounding counties around us that were contacted and had passed on that they weren't doing Ella, 4 of those counties are, as of today, either doing Ella or in the process, because DHHS contacted them and let them know it is your ethical and legal responsibility to assure this is done or refer and make sure this is done. We're not inventing something. We're not trying to do something that is not transparent. We are trying to promote public health. So if this goes away, if Ella goes away, if Plan B goes away, all of our hormonal contraceptions options need to go away. The difference between Ella and the controversy, and if you look on the internet, there's lots of things on there. Ella, the chemical in Ella is a chemical cousin to one of the abortion pills, but it does not do the same thing that pill does. It's at a much lower dose. It is not FDA approved. It will not harm a pregnancy. Will it thin the lining of the uterus? It can, as will any birth control pill, as will any implant in the arm, as will an IUD, which is even makes that uterine environment a little bit more unfriendly to a pregnancy. Kind of hard sometimes for fertilized egg to implant to that uterine wall when you've got a foreign body in there. So that little fertilized egg can make it all the way to the uterus. But you've got an IUD, that lining's thinned out, it may affect it. So if the deal is that it's an abortion pill because it prevents or can thin the uterine lining, then all hormonal contraception can do that. So if we can't do one, we shouldn't do any of them. And we're going to refer out, and we're going to eat up our Title X funding, and county taxpayer dollars will pay for it. Bottom line. And my staff that work clinic would like to also contribute.
I'm Megan. I've been here for 7 years. I worked in public health around 9 years. This is Linda. She's got 48 years experience and 8 years in public health. And Sean has around 14 years. 14. I'm going to be repeating a lot of what Loretta said, but emergency contraception is not an abortion pill. It will not harm a fetus. It's for people who are not using a regular method and doesn't want to be pregnant. It works just like regular birth control pills. If a woman is already pregnant, it will not cause any harm. Before we administer emergency contraception here, we do a pregnancy test and we make reasonably certain that the client is not already pregnant. And like Loretta said, we're prohibited to promote, refer for, or support abortion as a method for family planning.
I want to say, if you have ever used an oral birth control method, an IUD, a patch, a depot shot, then you have used a form of the emergency contraception. It is not an abortion pill, and it will not cause an abortion. Our personal beliefs about what is right for us is one thing, but as public health nurses, it does not give us the right to impose those beliefs on others. It's important that people are educated with factual information about the emergency contraception, just as Megan and Loretta has discussed. We can personally say that this has been the best working environment for us under the leadership of Beth Booth. We've all had job offers elsewhere with more money, but we have chosen to stay here at the health department to do what we love, serving our patients and our community. Our final thought is, how many abortions have been prevented because of the availability of emergency contraception to prevent unplanned and unwanted pregnancies? It is impossible to terminate a pregnancy that does not exist.
I have a question. Did Ms. Eller, did I understand you say that the Department of Health and Human Services has contacted all the counties in West North Carolina?
They have contacted Alexander, Buncombe, Burke, Caldwell. This came straight from them today, from Kristen Carroll, who is the lead manager under the Women's Health Branch. They've contacted Alexander, Buncombe, Burke, Caldwell, Cherokee, Clay, Cleveland, Foothills, Haywood, Henderson, Jackson. We're not able to get in touch with anyone at Jackson, but when I contacted Jackson last week, their nursing director, who has been there for years and years, had no clue what I was talking about, so that's another thing. Macon County, they contacted Macon County, they contacted Madison, they contacted Swain, Toe River, and Transylvania. Cherokee County Health Department had a standing order signed as of Friday, 11/4. They have ordered Ella. It will be on their shelves. They will dispense when it arrives, when the shipment arrives. Caldwell County was not currently prescribing it or dispensing it, but the MD is considering updating the policy to include Ella. And they refer out, like the state mandates, to another provider while they're not doing Ella. Clay County plans to offer. Standing order is in discussion and implementation and development. Henderson County dispenses and calls into the pharmacy, so they have it in-house and do call in. Madison County is not currently doing Ella, but plans to provide in the future. And with Ella, like I said, you have that time period the short time period that you do have to do the medication. So it is a time sensitive.
Do we have a number, how many times it's been used in Graham County?
For Ella?
Mm-hmm.
None.
None at this time. But, yeah, for Ella, and the only reason that is the case, it has not met the criteria that Plan B would not work. The reason we need to have it in stock, Ella is more effective. If you weigh over 165 pounds, you need Ella. It's going to be effective. Plan B will not be as effective. So that's why you need it in stock. But we do so well with our family planning program. Our patients usually are on a form of contraceptive methods. So it's not like emergency contraception comes up every day, weekly, or even monthly. It doesn't. One thing you need to understand too, the state recommends, they do not require, but they recommend that our medical provider for every family planning patient that they see, they recommend, and maybe correct me if I'm wrong, and we hear this every time they do an audit, that provider at that visit, say they're seeing a 16-year-old girl for birth control, for our initial family planning visit, that provider is, I'm encouraged as a nursing director, nursing supervisor, to have that provider write them a script for emergency contraception to keep for a year. So if a condom breaks, if they forget a couple of days of pills, or if they're not using their contraception and they have unprotected sex, they just go and get it filled and can take it. I'm not good with that. I don't want them to have prescriptions where they're not getting any counseling. Does that make sense? I don't want them to have a prescription to go get Plan B or Ella 3 weeks after they had unprotected sex. I want them to come and see us and let us talk to them and let us educate them. So having that prescription for the clients, the majority of the clients we deal with, I feel like would not be a preventative method, if that makes sense. I would rather them talk to a nurse. They can call us on the phone, come in and see us. We do a pregnancy test. When they have that prescription, they don't have to do a pregnancy test. They don't get any counseling other than what they got. And how many of us remember what our doctor tells us at our physical exam 6 months later? Do we always remember the details? You wouldn't remember the details. So I want them to talk to a nurse and have a pregnancy test.
I didn't plan on saying anything, but I do want to let y'all know that these nurses and Beth, I couldn't ask for a better group of people to work for. The caring that these ladies have for the girls in this county and the women in this county is just unbelievable. I see it on a daily basis, the care that they, and the worry that they put into their job. And Beth, she supports us so much that, I mean, we just couldn't ask for better leadership.
Can you repeat that, Ms. Conn?
Yes, I was having a little bit of difficulty hearing the member of the last speaker.
That was me, Linda Bradley.
But just to end my part, unless you have questions, there is no one in this room that we have the legal right to come between a patient and their health care provider. What you have control over as Board of Health members is how many barriers you're comfortable placing on care for people that seek the services of the Public Health Department. And just a reminder, remember what public health is. Public. It's for everyone. It's not what is best for our staff, Director Booth. It's not public health for what's best for this board. It's public health. It's for every resident of Graham County, regardless of religion, regardless of race, regardless of sex, regardless of sexual orientation, regardless of weight. For women like me that are over 165 pounds, they need the best contraceptive method that will work. So, we're not going to discriminate against weight, but public health is for public. And just because you do not have insurance, or you're underinsured, or you're at or below poverty level, in no way gives our public health board the right to deny services. They need to have all the services that are available to anyone else. Otherwise, we're not doing public health. We're just putting barriers in place.
Let me ask a question for me. I make sure I understand this. So we could refer it out and pay for that. I'm assuming at a higher rate.
If they go to the ER and convention.
So we burn through our Title X money. Then it is possible to be forced to spend taxpayer dollars.
Yes, it is.
On any of that.
Absolutely.
Right?
Absolutely. Same thing with our STD visits. If they need an STD treatment exam, like the nurses, we have standing orders that we can give. We can do STD testing and we can do STD treatment. We have STD drugs on our shelf that we can give them in-house at the health department. But if someone comes in and they're symptomatic for a sexually transmitted disease, someone comes in and they have abnormal vaginal discharge or pain with urination, we cannot do that self-collection for gonorrhea and chlamydia. So we have to refer them out to a provider. So if it's during the week, and they have to be referred within 24 hours. So we have a contract with Smoky Mountain Urgent Care, and we have a contract with Tallulah. So we refer them there, they bill us. We pay for the exam. Every time they have to go out of our health department to another agency, it burns that money down. And when our STD money is gone, guess who pays for it? The county.
I just wanted to make sure I understood what you said.
So same thing for family planning. We have to provide the service.
Since it's a required service.
Anything else? You got anything, Connie?
No, I don't.
All right. Annual board training. I got an email from Kim that at least part of the board had done it. Has everybody completed their annual board training? So if you were not on, I love your smile. If you were not on Kim's list, please send me an email confirmation because that does not generate a certificate. So please send me an email confirmation that you completed that rulemaking authority section 1 on that link that was sent on October the 3rd.
I think everybody took it except for Lynn, and he took his online.
I did that online. I give Kim the certificate.
Okay, so yes, just give me a copy of the certificate and we are good to go.
I don't qualify.
Anybody have any questions with anything that we have covered so far in the agenda? All right, and since we moved public comment down, can somebody grab the list? I think it's still out there. Thank you, Bailiff. Just, hand it to them and we'll pass it on down the table. I guess it'll be, is it Kim that called? I don't know who that is. Okay. And I guess you can just probably, the easiest thing is just to stand where you're at, since it's a little bit crowded. We can go from there.
Chris.
I'm here as just a citizen of Graham County. As a woman, a mother, and a stepmother to 2 daughters, and a step-grandmother and a grandmother to 5 children. I also want to say that these women that work here at the health department, every single woman that works here at the health department is the best group of women I have ever worked with in my entire life. They care about this community. They care about each person that walks through the door, regardless of who you are. And if I had to go somewhere for care, emergency contraception, or anything, these are the women that I would want to speak with, because I know the minute that I open my mouth and tell them anything, I will be treated with dignity and respect. And to me, it is very hard. I've been a social worker now for almost 23 years in Graham County. I don't deal with pregnant women. I mostly deal with the elderly and the disabled. But my first 4 years, I dealt with on-call children's services. It is very difficult to see what some of the children in this community have been to. I myself, my sister was raped. And there was nobody for her to go to, because I didn't know these services because we were young. I've had to sit in on interviews where children have had to disclose what had been done to them. And I would rather know that the people that had to have a service, be it emergency contraceptive, family planning, counseling, or anything, that there are women here, like these women, that they have that they can go to and talk to, because they will be cared about. Everybody here, from the minute they walk through the front door and they're spoken to by our clerical staff, to the nurses, to anybody, these people here care about this community, and they care about the outcomes of these people's health. And I don't want to see any service in this community lost because of misunderstanding, misinformation, something that's been totally blown out of proportion. I don't want to see us lose a service. As a woman in this county, as a woman to 2 daughters in this county, I want to know that those children, my daughters, have a place to go. When my granddaughter is old enough, I want to know that my granddaughter has a place to go where she can feel comfortable, where she can be cared for, and where she can feel like that her life matters, her choices matter. And that's what we have here in Graham County, and I don't want that to be lost. And I love you guys. I respect you guys, everyone. From the top on down, there's nothing I wouldn't do for any of you.
Kathleen Britton, is that how you?
Hey, I'm Caitlin Brighton. I'm a women's health nurse practitioner here in town. So that means I have my master's degree in women's health. I've been practicing women's health for years. This is what I do every single day, and this is what I've studied very intensely. So I came today just to give a little bit more of the technical side of emergency contraception, how specifically Ella, but also Plan B works very similarly. The idea with contraception is we prevent sperm from meeting the egg, right? When sperm meets the egg, that's a pregnancy. So the idea is we don't want the sperm to meet the egg. Condom, that's contraception, right? Keeps the sperm from getting inside the female body, going up the reproductive tract, all of this. So with, so let's drill down into the details of what happens with emergency contraception, right? So man and woman have sex, there is now sperm in the vagina. And what a lot of people don't realize is that sperm can live in a woman's body for 3 to 5 days. And actually there are some studies that show it can live in the body for up to 7 days. And that's a good thing for the human species because it's got a long trip, right? It's got to go all the way from the vagina. It's got to swim all the way through the cervix, which is a tight, it's closed tight. So it's got to get through that 3 centimeters. It's got to get through the uterus, which is another 5 centimeters-ish. Get out the fallopian tube, and then it sits there at the ovary and it waits. And it waits and it waits. And what a lot of people don't realize is the egg, once it's released from the ovary, it's only good for a couple of hours, right? So the sperm has got to be there waiting for it. That's our best chance of having a pregnancy, okay? So what happens with emergency contraception? We take this pill after we've had condom failure, contraceptive failure, unprotected intercourse, whatever it is, rape, sexual assault, okay? we take this medication and it tells our body, listen, just hold off on letting out that egg for a couple of days, okay? Just don't release it yet, because there's sperm waiting right outside the ovary to impregnate you. And so essentially it gives our body time to clear the sperm. It gives the sperm time to die, that 3 to 5, possibly 7 days. Gives it time to die. And then, we ovulate like regular and life goes on. But I know that there's this concern about what happens if we take emergency contraception after ovulation, or what happens if there is this pregnancy. And so we spoke to the thinning of the lining of the uterus. And what we know, that warning got put in there by the FDA from studies that were with 3 times the concentration or 3 times the dose of the emergency contraception that we use. So we use 1.5 milligrams of levonorgestrel, that's Plan B, or we use 30 micrograms of ulipristal acetate, that's Ella, and the doses that they used that showed that thinning that caused any sort of difficulty with implantation, that was 100 micrograms of Ella, so more than 3 times the dose. So it's really not something that we're worried about. It's when we look at studies, so it's hard to study this because it's like, would a pregnancy have occurred or not? So what we look at is, if we give the medication after a woman has ovulated, what is the chance that she's going to get pregnant? Is it any higher or any lower than a woman who didn't take any emergency contraception? And we find the rates are exactly the same. So that's what tells us that the primary mechanism of action of this medication is just telling the ovary, hey, just don't let out the egg just yet, okay? It's not this thinning. That, like I said, they put it in there because it's a finding at these 3 times higher. And so I did, so there are a number of professional boards, professional societies, international professional societies who have spoken to this, because clearly it's a concern, it's a concern, and understandably so, with this possible mechanism of action. And so one that I wanted to point out, so the International Society of Gynecologic Endocrinology, so endocrinologists deal with hormonal signaling, and then gynecologic endocrinologists deal with, like, specifically women's hormones and pregnancy signaling, this kind of thing. And what they say, there is no evidence to suggest that an effect on the endometrium, the lining of the uterus, accounts for the efficacy of Ella in preventing pregnancy at a dose of 30 milligrams, nor that Ella 30 milligrams is an abortifacid, which, it causes abortion. So there's no evidence. And that's an international society. So that's all the smartest gynecologic endocrinologists in the whole world that sit on this board, and they review the best evidence we've got. They say that's not the case. And then the other one, the International Consortium for Emergency Contraception. So again, international society, this is not, they look at the science and they say the primary mechanism is disruption of ovulation. Other mechanisms have been postulated, but are not well supported by data. No evidence supports the theory that emergency contraceptive pills interfere with the implantation of a fertilized egg. Emergency contraception pills do not cause abortion of an existing pregnancy. So I felt that those are really strong statements, again, from very esteemed professional societies who understand all of this with a lot more detail than I ever will. But the other thing I did really just want to emphasize Larita's point, and I see this in practice, I know this from the literature, from the data, from the studies, is that if we make it harder for women to obtain contraception, they're gonna go get abortions at a higher rate. It's the case. And in North Carolina, it is still legal. They just have to drive to Asheville. So if we don't want our neighbors, our daughters, our family members, our congregation members, our coworkers, if we don't want people to feel like they have to make this decision, do I need an abortion or not? We make contraception available. We just prevent the sperm from meeting the egg. And that's the technical aspect I wanted to share. That's okay. That's all right. It's a tough one. It is.
I think Ms. Shelby Owens is next.
She wants to pass. You can go
Yeah, sorry, I thought it was a sign.
I think Ms. Jill Raymer's next.
Hello, Commissioners.
I'm Dr. Jill Raymer. I currently work at Tallulah Health Center. I'm here as a private citizen today and one of your advisory board members. I was a previous nurse practitioner for Graham County Health Department, so I am very, very aware of the functioning of the health department and the family planning clinic and the quality of your current staff. I've been serving this population now since 2015, and I've been sitting on the health board advisory capacity since about 2017. I currently have a pretty large patient panel in the county. I do have quite the pulse of what is going on here, and I have a long history of healthcare service for over 40 years. I'm not really that old, but yes. The current discussion on family planning in our community is being conducted by an elected board, and most of you guys are male. I really feel that that's a disservice to our female community members. The people that are currently seeking service for our health department aren't the ones that have health insurance and can easily access care. Is are disenfranchised in our community that have the least availability of providing for an unplanned pregnancy and or abortion. What is being discussed is contraceptive planning, not abortion. Contraceptive has never been an issue and is not involved in the Roe versus Wade overturned decision. It's legal in all states and protected. This decision should only be made by the healthcare professional and the patient only. Like those that are on the advisory board are your healthcare professionals. It's not to be made by any individual that has no healthcare background. So, and you guys should not be an active participant in any of these discussions. Your threats that I've heard through in the community of possibly terminating our director is very ill-advised. Beth is doing an excellent job. She's been recognized by our state for her contributions with the COVID crisis, and this health department has been recognized as a model and sample for the other health departments in the community. To jeopardize her job because she's doing her job is really, she's doing her job protecting the reproductive choices we have in our community, and I think that any involvement in stopping that is a travesty. In 2016, I faced the board like Beth does today. I was unjustly accused of violating a collaborative agreement with our health board director, and the board heard my case and voted to let me go. This decision was inappropriate at the time, and I was falsely accused. I proved that I had not done the action that they said at the meeting that night. I was immediately hired by the healthcare center and served this community with high quality care since, and I also help assist with the health department in their needs. The decision you guys made that day cost the county not only in revenue that now I'm giving to Tallulah Health Center instead of our community, and you also know the headaches that you guys have had to deal with trying to reproduce the services that I was doing in urgent care and things like that. You guys haven't had any headaches with urgent care, I'm sure. And you are now in a lawsuit, and that's not a real good use of my tax dollars. We have an excellent director. She knows her job. She knows the mandates that the state has. Loretta knows the mandates that the state has. And this funding is very important and make sure services are offered to our community. You stop giving those services, you stop losing that funding, and you have to cover it one way or the other. If you vote to, sorry. How much is it going to cost to replace an effective director? How much is it going to cost for headhunting and to interim replace her if there's any issues there? I should have done a wrongful termination suit, and I strongly would encourage her if this is the case. I think the board needs to be only healthcare providers and no longer run by the commissioners. They have no knowledge base. Required to keep our county health at the forefront instead of your re-election issues. Thank you.
Thank you. Mr. Jay Coward.
I'm embarrassed to admit that I thought that was a sign-up for attendance.
And both our names are on it.
And what we're here for is that we were asked to produce a report, which we have turned over to the commissioners. And we're not here to make any public statements.
Okay.
No.
We'll move on. This quality fix.
Okay, I have several things I want to address. The first one that I kind of just found interesting was Lorita's thing that she typed out that said emergency contraceptive options, Plan B, and Ella.
Come up here, Connie.
Me?
Connie
Connie
can't hear
couldn't
you.
hear you. Okay.
Yeah, so it's right here.
Okay, so to start with, I kind of found it interesting because the thing that Loretta typed up to give y'all broader information about the Ella and the misinformation and all of that, a lot of that was good information, but one of the things that she put on there is that the emergency contraceptive options, Plan B and Ella, are available for administration or by prescription at the Graham County Health Department. And my public records request that I got from Jason today, and this was dated October the 31st, and Jason's was today, and I'm not sure who told you this, but it says that after extensive search, Graham County can find no record of Ella ever being administered at or by Graham County Health Department. So,
That's true.
well, this right here says administered, honey, that's the same
It's
word.
available.
It's
to be
available.
administered.
It's hard, it contradicts each other, because it
It's
says that
available
it
to
is,
be
and this is my 5 minutes, if you don't mind.
I've got the right colors on, girl.
You're good, girl. So, you know, but it says it's available for administration. This says that it's no record of it ever being administered. So
It means
there is administration there. I didn't interrupt you when you were wrong on anything, so I'd like the same respect for that, on that. Let's see. Let me perfectly see, I'll hold up on that. So back in August, Brandy came up here to gather fact-finding information so that she could present it to Appalachian to help promote a broader range of services for pregnancy awareness. I know the board's aware of that, so I'm not going to go into a lot of that detail at this time. But I did want to touch base on a few of those things. So touch base on that. So under Title 10, Graham County Health Department is required to either contract through a pharmacy or distribute their own products. During the course of that, they develop a formulary. 340B drugs has a whole range of drugs. I don't know how many birth control methods there are out there for birth control pills, but Graham County can pick and choose which of those pills that they want to administer. And if there's 100, I'm sure they don't want to administer 100 or have that pharmacy through contract say that, you know, have 100 of them on standby. Emergency contraceptive is controversial. Nobody's denying that. It's all whether or not you believe that once an egg is fertilized, does it become what you consider life or not life, or does it have to attach? The Ella pill is designed to prevent that from attaching, but when you read the guidelines on the Ella, it plainly says that when taken correctly, that's a key thing there, when taken correctly. Correctly, according to the FDA recommendation, or the Ella distributor there, is to take it prior to ovulation. Well, since we're all frank here and we've all probably had sex, how many of you check to see if you've ovulated before you have sex? The only time I know of people checking to see if they've ovulated are people that actually want to get pregnant, because that is a big key thing, is to try to have sex when you are ovulating, because the risk is higher. So if you don't take it
when they recommend it, what's the chances of you then becoming pregnant? That's the underlying thing. We do not in Graham County have to offer emergency contraceptives. If we do, we can offer Plan B, which is a watered down version of what Ella is, and Ella is a watered down version of the RU486 pill. Nobody here that I'm aware of, has made it to where Ella is the RU486, because it's not. It's a watered down version. But we've had lots of watered down versions to be distributed through prescriptions, and then it becomes over the counter. That's what Plan B is. But Ella is actually a part of a Plan B as well. They just call it Ella. We do not have to offer that. We can still provide those services. And since we've never administered or distributed Ella, who gives a happy rat's pine in if they have to go somewhere else to, and it costs us money. I'm not talking about go somewhere else. I'm just talking about if it costs Graham County taxpayers money, if we expend that. And who has the right here other than this board member to say we're not going to offer any of it? Red Ella doesn't. Beth Booth doesn't. Y'all do. Y'all decide, yeah, you're going to offer it there at that health department, and to say we're not going to if you don't do, that's not right. It's not right. It's not right to do that. So,
as a woman who's over 165 pounds, although I'm not in any way, shape, or form, if I wanted to come to the health department with unprotected sex or my birth control failing, I would want to know that there's an option that would be accepted for me.
And it's okay to give you that option. It's okay to even tell
But
you
I'm
about
hearing that you don't want it.
No, this is my time.
Okay.
So Ella contains ulipristal, and that is the same drug as they have mentioned that's in the RU486, but it's not as strong. It's not. It is a watered down version, like I said. But when you look at the 2010 docket that was sent to USDA from the American Association of Pro-Life Obstetricians and Gynecologists, they're talking about, and I don't want to confuse this, I want to make this clear, this is on the RU486 and not the Ella. They're talking about the type of drug and what it does here. So this is talking about the ulipristal. It blocks the progesterone at the level of the endometrial glands. I mean, a lot of this is medical stuff. And destroys the receptivity of the endometrium so that the endometrio cannot implant. It destroys the capability of the corpus cells to produce progesterone. And it blocks the receptors. And it says the embryo mechanism of action distinguishes ulipristal from the longestrol, which is the Plan B. It's daylight and dark difference. And it does the Plan B does not disrupt the pregnancy that's already been implanted. Again, I'm not trying to mix those. This that I'm reading on is the RU486, and that's not what the health department is offering here. But it does have that component in it that can and does destroy the egg. Now, on number 2, I got this off of the Ella platform on the tablet there. And when you go over, it talks about how it binds a human progesterone receptor and prevents the progesterone from occupying its receptor. Similar to what Loretta has said on that. Number 3, it's talking about the Ella as well. And then you come on over here, and in that labeling attachment for the Ella, you come in under the FDA approved patent labelings, and it says, how does Ella work? Ella is thought to, this is FDA, this is not me, this is not pro-life, this is FDA, and it says, how does Ella work? Ella is thought to work for emergency contraception, primarily by stopping or delaying the release of an egg from an ovary. It is possible that Ella may also work at preventing attachment, implantation to the uterus. Well, hello, if it's fertilized and it can't attach, what's it going to do? It's going to abort. Period. You make up your own mind if it has to be attached. That's up to you. That's up to this board, not us. It's up to this board. That's what you were voted on for. What you were voted in for is to make these decisions, to hear us when we have these types of questions. Okay. So I got through the public records request, the unapproved minutes from the last meeting. Don't know if what I'm telling you is accurate or not. I just know what I've heard from a pretty reliable source that that this same thing was discussed with the advisory board and that reinforced that it's not an abortion pill. Ella is a EC until it's fertilized, and when it prohibits that from attaching, that is what it's doing, and that is how it acts. And I have read studies, and I did not print them off, and it may be in some of this, I just didn't highlight it, I'll put it that way, where they have shown that there were pregnancies, that there were miscarriages, that there were ectopical pregnancies, that there were these things happening. I just don't remember the numbers or how high or how low that they were. But there are studies that do have that, because I read that. I did not highlight that, though, when I was doing all of this. So, let's see. Anyway, this advisory board, I'm told, went into a closed session, or was told that they were in closed session after you, Jacob, had hung up the phone. Just really curious about that. I mean, why wait till you hang up the phone if that's true? That's up for y'all to discuss. So you've been told that on that part. It's interesting that because this drug is so controversial, that the Ella pill has never been on their formulary list. You have the choice to decide whether or not you want that on the formulary list. Title 10 is very specific. It does not pay for abortions. That is true. They've got other programs that will allow for such things as that. But under this Title 10 program, it does not do that. But it does cover for extended contraceptions. Plan B, you can get over the pharmacy, buy it over the counter. They've got Plan B over the counter. They've got, which is a very watered down version. They have Plan B, and they have now lumped Ella under Plan B. But Ella specifically can be excluded from the Graham County formulary and not be offered. You can do that. We have a higher calling to answer to, and I don't care what any information is. You have to dig for this stuff. FDA doesn't put this out here and make it easy for you to find. It's not things that they really want to promote. It's not things that they really want to make available to where it's easy. You have to dig for this. You have to talk to other gynecologists, other people that are in the know, that have experience in this, to understand the medical terminologies of what's taking place right there. So, there's a lot to that. But my thing is, when Brandy was here, everybody wants to talk about how friendly it is, and there's the health department's got some wonderful people. I don't even mean to imply that. But under Title 10, I just found it interesting that, beliefs were mentioned here several times. Beliefs. I just find it interesting that beliefs are true out there. And this is based on belief. But Brandy, when she came happy, and she left excited. to the point that she was so excited that she texted her husband and said she just had wonderful news, couldn't wait to talk to him about it. Couldn't wait. Excited to death. Only to lose her job within an hour. Well, what happened in that hour? What happened? Video cameras don't show her acting up. Video cameras don't show her escorted out of the building. Video cameras don't show her acting irate. The only thing video camera shows is a mother of two sitting there and her playing cuckoo with a little baby and the mother not one bit concerned, showing her to be talking and thanking Sean, thanking Loretta, and saying bye to them. Had a wonderful meeting. What happened? Did somebody call Chantel 5 levels up to complain about Brandy being there just because she wore a badge and was doing her job? Come on. Who has time in a busy schedule to make a phone call to say, I just wanted to let you know that your employee was here and she had her badge on? Well, she sure did. She had a name tag on because she was fact-finding and gathering information so that she could pitch it before her supervisor, her peer, to offer it as an alternative source because she was encouraged by AMCHC to offer perspectives from a religious perspective. She documented that, and within an hour of leaving here, she lost her job. She lost it. Well, let me tell you what Title 10 says about that. Title 10 tells you that under Title 10 funding requirements, and its requirements, and under Section 9, it says, agencies must provide the opportunity for participation in development, implementation, evaluation of the project by the persons broadly representative of all significant elements of the population to be served, and by persons of the community knowledgeable about the community's needs for family planning services. But number 20 is what I love the best. It says agencies must provide for opportunities for communities, education, participation, and engagement to achieve community understanding of the objectives of the program, inform the community of the availability of services, and promote continued participation in the project by diverse persons to whom family planning services may be beneficial to ensure access, equitable, affordable, client-centered, and quality family planning services. So Brandy went to Graham County Health Department to seek education, to seek participation, which Loretta agreed to, and engagement in the community, which she asked for, to seek understanding of the objectives of the program because she was reading information, pros and cons on the Ella pill herself, and she wanted to be able to pitch that program so that she could provide that program to her boss so that she could help lay out the pros and cons to a pregnant person by the project with diverse persons and family planning services. So Brandy did that. When you go on over to number 7, it says if the agency has either an agreement with an off-site pharmacist to come into the clinic on a regular basis to manage contraceptives for the patients or send the patients to a local pharmacy, it must have a contract or other formal agreement in place with the pharmacies. So there has to be a formulary. Now, I got a copy of that pharmacy agreement that went back from 2013 to current. I was kind of took back by it because it says contraceptives. But you know what? FDA labels birth control, IUDs, and all of this stuff as contraceptives, but it specifically pulls out Plan B and Ella as emergency contraceptives. So do we offer contraceptives that's broad, or on that formulary for that contract with the pharmacy, do we offer emergency contraceptives? I mean, which one is it? It's not on that formulary list, so why are we offering it? Why is it not specific? I'm told it ought to be more specific. I'm told that it needed to be pre-approved. I don't even know if it's a binding contract or not, but that's what I was given today. But there's no drugs listed specifically on that. It just says contraceptives. When you get to reading all this stuff, it dead burn breaks that out and it's clear. Now, you can go on over to the Office of Population Affairs, and it is the Title 10 handbook. All of this is public record, but you, by golly, you have to search for all of it. I mean, it's not anything that's going to just jump out and get you. It also says that, therefore, per regulation, Title 10 projects must ensure services are provided in a manner that is client-centered, culturally, blah, 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 and ensures equitable and service quality delivered consistent with nationally recognized standards of care. We've got to protect the dignity of the client. But who is the client? Now, Brandy she wasn't a patient that day, and it breaks out patient, but now a client. So just because she was on her job, does that make her a client? It did. We got issues here. And then we come up with developing standards for the staff. And then we go on over to project administration under the Title 10 recipients. And it says provide services in a manner that does not discriminate against any client, based on religion, race, color, national origin, disability, age, sexual orientation, sex, gender, identity, sex characteristics, number of pregnancies, or marital status. So who is a client? One word can change a whole contract. You're going through that with urgent care right now, and one word is what's saving our goat. One word. What is a client? Client, depending on which dictionary you look at, it's a person or a group that uses professional advice or services as a company. Well, you know what? She was in her capacity through AMCHC wearing that little badge. It's really a name tag, but it was called a badge. So is she a client? Yep, I believe she was. Yeah, I'm being a smart aleck, and I'll try not to. So anyway. It also says that you can't target based on religious beliefs. Well, I just heard these people talking, and one touched on regular religious beliefs, but the other ones are based on your beliefs. Well, I guess you could spin that any way you want to, but I just found beliefs interesting since that's what she told Brandy. Beliefs, since that's what Brandy's boss said she told her. Now, did Chantel lie? I don't know. I wasn't part of that conversation. I just know what she said, and I know what she said. She mentioned beliefs. So if Brandy said that Chantel said beliefs, and she said beliefs, at some point in time, you just got to get to asking yourself, what's what going on here? These 340B drugs is a formulary that the federal government has approved, and it's a whole slew of them. And it's just a list of drugs that has been approved under that formulary. You do not have to administer or offer all of those drugs. You do not have to make the decision to give up other types of contraceptives if you choose not to. It is a personal choice. It is a personal religious belief. It is a personal belief at when conception starts. But at the end of the day, who do we answer to if we believe that there is a God? And if we got by with it all these years, surely to goodness, with all these educated people, we could not provide the quality of service that these people in need. Go on over and look under this Title 10 handbook, and it also talks about how you apply for those grants and the requirements that have to be met. And let's see, I wrote that page down. Let me find it. It says to provide a broad range of acceptable and effective medically approved family planning methods, including natural planning methods, and it goes on through. But there's a lot of broadness there that they give these health departments on the type of family planning services that they want. Now, no doubt somebody's complained to the state and somebody may have filled out grants wrong. I don't know. Loretta said that they were contacting them, and it may be something that they're doing to try to clean up based on what box they've checked. But when you get to looking at this, you do have a choice. This is a complicated thing. It pulls down, and if you're not real careful, you can overlook a lot of stuff. But at the end of the day, we don't have to offer that. We can pull that part of it out of our funding process and not do it. And since they've never had to send anybody over to that, if somebody needed some type of service that was more on an emergency basis, I mean, people here are such giving people, but help is what they need. They need the guidance of God. They need the guidance of friendship. But these IUDs and things like that, they can damage you. And they are a form in an odd way of ECs. That is true. I mean, when you look at that, but Ella plainly says in FDA's own words there that it can prohibit that from attaching. And when you prohibit the attachment after it's been formed, you have to decide. When is a baby a viable baby? When is it fertilized? When does life begin? Does it begin at conception? Well, if it begins at conception, Ella's not an option for this county. We're in a Bible Belt community, and we don't believe in abortions, but we love those that have been afflicted, and we want that help to be out there. But I think there's another way that we can provide that to the people that's in need besides promoting this. But Title 10, in my opinion, has been breached quite a bit. So when you look at some of the language, it uses recipients, which is, who awards that. I pulled that up under the North Carolina DHHS site, which has to adhere to the federal guidelines, which is some of what I gave you. That's really documented information, and it may be for a court to decide on something like that on a word. Who's a client and who's not. She was not a patient, and nobody's going to argue with that. I mean, it would be a whole different conversation if she was. But as a client and as a fact finder, and where it is requiring community participation and awareness, it requires that. She did not have the duty nor a responsibility to call anybody and report. And on top of that, Brandy's been down there working with other peer support people before. She didn't call on them then, only when the awareness of Ella came up. And if I'm not mistaken, seems to me with the gossip in the community, that breach of contract was not on Brandy's part per se, but on the Ella part, and the awareness being brought to light was a big issue for the health department. And I'm going to hush. I think that's all.
Miss Brandy Adams, you're on the list.
Yeah.
Okay.
The only thing that I'm going to say, I won't take up much time, is, a lot of things in this room has revolved around what science says, what, all these studies have said. And, science also said we came from monkeys. So, we can't always go on what science says. And just because they say it doesn't mean that it's correct. And this Ella pill, it's almost, I came down here very innocently, not even knowing that he was going to cause all this type of uproar. And the speech that Nurse Supervisor Loretta gave was almost verbatim what she told me on August the 9th. But when I looked at her and I said, Loretta, I want to know Christian to Christian, woman to woman, mother to mother, what is your opinion of the Ella pill? And she told me it's nothing but abortion. Now, I've never seen that. That's what she said. There was other things that were discussed in that meeting,
And I give her my word that I would not say that, and I'll hold my word still to this day. There was things discussed in that meeting. And it's your personal opinion. Yes, we all have personal beliefs. And I believe that life starts at contraception. I believe it starts at fertilization, period. I got pregnant with my daughter on birth control pills, never missed a pill, but it never one time thinned my uterus lining to where I miscarried my daughter. To me, that is abortion. No, it's not RU486, but it is still, it's basically like if a homeless person comes in off the street into this building and there's no walls or roof around this building, do you think they're going to be able to live and survive in the weather without food, water, a roof over their head? No, eventually they are going to starve and die. That's what Ella does if the egg and the sperm reach each other to be fertilized. That embryo or that baby is what I'm going to say. When it makes its way down to the uterus because it does not have the hormone needed, because Ella took that, it has nowhere else to go but to abort itself or force a miscarriage. Period. That's just a simple analogy. And you know, we can sit in this room and we can talk about women's rights. Well, what about these babies' lives? What about their rights? We're not even giving them the option to survive. We're worrying about everybody about women. I am a woman. And I know people get raped. That's sin. And I hate that. But it's not that baby's fault, just like it was not that woman's fault that was abused or raped, period. But that baby is just as innocent as what she was. And who gives us the right to do that? And you can look up Ella all you want to, and the difference between Ella and contraception pills, birth control keeps you from ovulating, period. Emergency contraception comes after the fact. After. So if you do not know that this girl comes in and she's ovulated and she's already pregnant, then how do you know you're not already causing that baby harm when it tries to reach the uterus? You don't. And there is no pregnancy test out there that you can give someone the next day that is going to show up that they are pregnant. That is science. So look, if we all want to be scientific here, look up science. There is no, even a blood pregnancy test is not accurate until at least 10 days or after. Ella has been used in a study with women in the second trimester of their pregnancy. As a study, second trimester, that is when they are already getting their organs, they are already breathing, their heart is beating, everything. And it was used then. So, I innocently, no. God chose me and put me in this position. Why? I don't know. This is not a fight I chose to take on. But I will stand before God one day and I will not answer that I may have took the life of an innocent child. I will not do that. And I hope and I pray that Graham County makes that decision as well. And a judge was contacted today in the state of, or in Charlotte, and he said it is illegal for Graham County to pay any type of bill if a patient was sent elsewhere to receive that type of medication. He said that is illegal. A judge in Charlotte said that. And he said if anybody on this board wanted to talk to him about that, he would gladly give you that information. A judge. That is not true. And we do not have to be offering Ella. And the last thing that I want to say is, if Ella only is good up to 5 days after unprotected sex or whatever it is that happened, what's 1 hour on up the road? The blood on this county's hands is more priceless than an hour up the road. If it's good for up to 5 days, what's an hour? What's an hour? But my Bible, and I brought this here today for a very reason, my Bible says that life begins in the blood. In the blood. And there was rape in the Bible. There was stuff that went on in the Bible. All through it. Read it. But there was no Ella pills or emergency contraception back then.
Sin is going to happen by having stuff right at our kids' fingertips or a grown woman's fingertips is wrong. It is wrong. And I believe we have enough to answer for as to add this to the list one day. And it's wrong. I have contacted Planned Parenthood. I have contacted Pro-Life. I've contacted Pro-Choice. And you ask any of them that Ella is used to keep a fertilized egg from attaching to the uterus by starving the uterus of progesterone needed to let that baby grow. No, it's not for RU486 where the egg is already in there and it's already growing in the uterus. No, it doesn't work like that. But it keeps it from before it even reaches there. But life to me begins at fertilization, period. I'm pro-life all the way, and I believe that abortion is wrong. This is a watered down version of abortion, and I just hope and pray that Graham County does not have to answer for that one day. It's wrong. It is terribly wrong. And I know, and the person that I had the meeting with knows what was said in that meeting, and we had a wonderful conversation. There was tears of joy in that conversation, in that meeting. It was wonderful. Why all of a sudden this has happened, I don't know. But this much controversy over one pill cannot be of God. It cannot be. He is not the author of confusion. He plainly tells us that in this Bible. And I hope and I pray that we don't look at science, because of what science says a lot of things. We need to be looking at what the Lord tells us. And it's wrong. Abortion is wrong.
Thank you. That's it.
There is no old or new business.
Do you have any personnel or
Yes.
contracts? Closed session. Any motion for closed session GS 143-318-11A16, privileged or confidential information?
So moved.
I hate for all this to get all get done. From all that we've heard this board, from y'all, and there's some new things that we didn't hardly know about. So right now, there's not going to be a decision made, because we need some more information from our attorney. And so we're putting it off for right now till hopefully, if we get all the information, hopefully it's the next board meeting, which will be next Tuesday.
When's the deadline for the health department to submit their application?
Yes, so we are submitting our application tomorrow for family planning as written. Does the board have any problem with that?
Attorney?
I don't.
Okay. No, we don't.
Does the health advisory board have any problem with the way that the...
Absolutely not.
Anything else?
But you know how I stand.
Yes, I do, absolutely.
Okay. Anything else? We have a motion to adjourn.
Motion.
Second.